The vast majority of the surgical procedures that I do are done under what's called regional anesthesia with sedation. And that is different than both local anesthesia and general anesthetic. So what is regional anesthesia with sedation? Perhaps you've already met with the anesthesiologist just prior to talking with me, but ultimately they've suggested to you that they want to do three things to you. The first is sedation, and basically what that means is through an intravenous, they will make you asleep. So basically they'll give you some medicine and you will pretty much snore, you will be unconscious, you will be out cold, you won't know what's going on, but most importantly, you will keep breathing for yourself. And that's different than a much deeper level of sedation that occurs in general anesthetic where you stop breathing and therefore a machine called a ventilator breathes for you. Recognize that the majority of our patients undergo regional anesthesia with sedation as the anesthetic of choice for surgery, but that is always uniquely dependent upon the nature of the procedure, general health, and ultimately your decisions as well. So now that you're sedated, you basically won't remember anything, but what the anesthesiologist will suggest doing to you, that or will do to you, is make you numb from the waist down, and that is not terribly dissimilar than what you know of as an epidural when, for example, a woman is undergoing childbirth. The distinct difference is that when a woman is undergoing childbirth, she's attached to a baby. So the mom cannot be sedated for her epidural because the baby can't be sedated. So a mother typically has an epidural awake. Clearly not an exciting or pleasant experience. The difference here is that there is no baby. You will be sedated first, and therefore you have no recollection of what they have done to you, but what they will do is the same block in your back, making you numb from the waist down so you feel nothing and don't move as well during the operative procedure. So let me reemphasize that this spinal anesthetic that you just had is done after sedation. You will have no recollection of it. After you have that block, but again, before I've started the surgery, the anesthesiologist is going to suggest that they give you another block, typically behind your knee on the surgical side only. So again, after sedation, so you don't know, but giving you a block behind your knee, not with medicines that are short-acting like the spinal, just to last around a little longer than I need for the surgery, but with long-acting medications that may last on average between 1, 2, or even if you're lucky, up to 3 days after surgery. And that's the best part about this, because you will wake up without having pain, and the traditional painful aspects of having foot and ankle surgery are very different these days.